David Callecod, President and CEO of Lafayette General Health System.
Thank you.
I want to thank both you and Senator Mills for inviting me here today to share just a little bit about the cooperative endeavor and the impact on Medicaid expansion in Lafayette. In echoing some of the comments that Fred Cerise shared, obviously hospitals across the country support expanded coverage. Whatever that expansion is, whether it's Medicaid expansion or some type of voucher program like is going to be happening in Arkansas, the more people we have covered, it definitely will help us going forward, particularly in light of the changes because of the ACA. In Lafayette, the important points of our CEA is that it's a capped amount. There's a cap in the spending that will happen in Lafayette, and so for us, it just takes it from one bucket, and maybe you take it out of another bucket in terms of Medicaid funds or state general funds and uncompensated care. One of the biggest fundamental issues that I think we as a state need to understand is that if there is Medicaid expansion, one of the challenges we're going to face is that the LSU physician network is the primary provider for Medicaid patients in our state. And so Medicaid expansion and the impact in Lafayette will be, I think, incremental growth in the volume of patients that are presenting to our physicians at our new campus when we take over June 24. Because private physicians, most private physicians do not take Medicaid patients for primary care and specialty visits unless it's an emergency. So it will drive a significant amount of new business to the partnerships with Medicaid funding just simply because of access.
Senator Mills.
I guess the question would come back from what you've modeled. If you don't have any expansion at all and that uninsured population is seeking services at the LSU clinics in that area, what happens there with the cap from the standpoint of, and the DISH dollars aren't there as they have been? What does the modeling look like there?
Well, the funds are going to have to come from somewhere, and certainly, it's a combination in our deal of UPL, DISH, UCC, all those types of funding, and so to make up the cap, it's going to have to come from somewhere. The more remarkable sort of harm will happen at the main campus when DISH dollars really disappear from our 353-bed main hospital. And so that really is the more dramatic impact, certainly in our system, would be the effect at the main campus.
Thank you. And thank you again for stepping forward to help such a community that needed the help of your organization. Thank you.
Thanks, Senator Mills.